Hello fellow nurses, hi guys, welcome back to my channel. Yes, I am back. I know it's been a long time since I made a YouTube video or since I posted anything on here. I took some time off work. I lost my dad in July and I just traveled to Kenya, traveled back home for the funeral. I was lucky to have traveled when he was still in hospital, so I got to spend the last days with him. But now I am back. Trying to just, live this new life, trying to adjust to life without him. So having said that, I am super excited to be back to create more content, to continue to empower nurses. If you're new here, thank you so much for stopping by. Please hit the subscribe button and tell a friend to tell a friend. My name is Gertrude. I'm a registered nurse and I am a world-class nurse. Yes, so I create content that just empower and motivate nurses and help nurses to become world-class professionals, as well as feel good about themselves, because you know what, when the nurse feels good, the doctors feel good, the patients feel good, and everyone is happy. Trust me, everyone is happy. Like nurses, we are that glue that holds everything together. Anyway, so welcome back to my channel. Please hit the subscribe button and let's get this started. So anyway, one of the topics that has really trended in the past month or so is the new Kenya-UK deal. And yeah, I saw it in passing. I mean, at that point I was really still undergoing a lot of stress and emotions, so I just saw that in passing, and there was a lot of mixed reactions, I can say, because people have different opinions about the same thing. And I thought about just talking about this, sharing the information that I have, or my own understanding of the terms of the deal, and then also giving my opinion, like, do I think it's a good thing or it's a bad thing? So let me start by saying that at the minute, we don't have a lot of information on the details of this partnership. Like what was done was just a press release, a 2-page document just highlighting what to expect, but the exact details and how it's going to take place, we still don't know. And I think from the press release, they said to be announced in the next 3 months. So there has been a lot of speculation and rumors around this. I think it's too soon or too early to tell. So anyway, let's get straight into it. So all this information I'm sharing is from that press release, that my own understanding and what I gathered from it. So it's the Kenya-UK health agreement, and I want to think this is an extensive agreement. The points that I gathered from this press release, number one is there will be a special route to the UK for the specific healthcare workers. So a special route, it means that right now we have the way of getting your visa, the steps to working in the UK as a nurse at the minute. It's just you have to do IELTS, you have to do NMC-CBT, you have to get an employer who is also your sponsor for the visa, and then you apply for the visa, and just like that you come to work. But they say a special route, just that. So at this point, we don't know what that special route is. People are really speculating. I've heard a rumor that the nurses may not be required to do IELTS, which is just an exam for English proficiency. That was not mentioned anywhere. So I'm not sure. I really don't think that is going to be applicable, because as part of not just for the UK, but for most of these countries, like, you have to prove the language proficiency. It's not necessarily English, it depends with the country you're going to. So you need to prove how proficient you are in that language. So I'm not really sure if that will be applicable, but like they said, there may be a different route that the nurses are going to use to come over. And then something else is these nurses are going to work for the NHS, which is just the public sector in the UK. So currently, if you want to come to work in the UK as a nurse, you can work in the NHS, which is the National Health Service. You can work in a private hospital, or you can work in a care home. So this is exclusively government to government. So all these nurses are going to work for the NHS. Something else is that was mentioned in the press release is that these healthcare workers may need to return back to Kenya's health sector at some point. So I'm not really sure what that means or what that would entail, but there's that what is Kenya going to benefit from this? So having the healthcare workers go back at a certain point, maybe, we don't know. I don't know for sure, but I picked that from the press release. And they also mentioned the Kenya-UK Health Alliance, which is just a collaboration of universities, and they're mainly going to focus on cancer treatment and cancer management in the country, in Kenya, and probably in the region as well, because better cancer at the moment, if you want proper affordable cancer treatment, many people have to travel to India, and medical tourism has become a thing. It has become a thing of late because there is no proper care in Africa, in Kenya, in Africa for especially cancer. So if you can't afford to go to the likes of Aga Khan, the only other option would be going to India. So right now, this Kenya-UK Health Alliance is going to train healthcare providers on cancer management, which I think is a really good thing. They mentioned universities like Kenyatta University, the Teaching and Referral Hospital. I saw Egerton. I remember seeing Egerton as well, and Manchester University. So the details of that program, like I said, it was just the press release, so we don't have the details, but I think that would be a really, really good thing. So the thing that most people have been asking, is this a good thing or a bad thing? The thing that people have been asking, is this a good thing or is it a bad thing? Because we know the state of our healthcare, it's really one thing. And just to share a bit of personal information on here, when I left Kenya to come work in the UK in 2019, I think for a period of time, especially in my first 1 year, I was feeling some form of guilt in the sense that I should be back home, I should be working back home. I'm being unpatriotic, is that a word? I'm not being loyal. So I was suffering with that guilt, they really need me back home, but I'm here in a country that has its healthcare system in order. But I think I overcame that at some point, because I realized I am giving back home in one way or another. I give back home a lot, so it's not necessarily a loss to Kenya for me being here. So there's been that issue of the Kenya's health system is still very weak. Why are we sending our healthcare workers away when we need them? There's a shortage of healthcare workers, clearly. And the logic does not add up, the math does not add up, because why train, for instance, training a BSN nurse through government sponsorship costs them about 250,000. So close to 200,000 the government is spending on training one nurse per year. So what's the logic of, after training this nurse, then you take them to work in another country? So in that sense, it does not add up. But in my own opinion, I think this is a good thing, because what's the point of not being employed back home when you can come here and give back to Kenya in one way or the other? And I'm talking about the money you send home on a monthly basis, projects that people are doing from here. The nurses are doing different projects. Nurses like myself who are creating programs that are just aimed to, empower nursing back home and all over Africa. So I think for me, this is a good thing. And as well as improving the cancer management, if things go the way they are meant to go, if they really, really, deliver the program as intended, or the word has gone, but if they really execute the agreement has intended, then there's going to be improvement in cancer management as well. So this is a good thing. So as I wrap up, at the minute, we don't know the exact details of how this works. Something else that came to my attention yesterday was another a press release, by the State Department of Labor. It looks legit, I'm thinking, because it has like the emblem and everything. So according to this, there's an eligibility criteria for the recruitment, and they said you have to be a Kenyan citizen, have a diploma or bachelor's degrees in nursing, be licensed by the Nursing Council of Kenya, obtain a valid police clearance, and not be in paid employment either in public or private sector. So this is something else that was really mentioned in the press release as well. The program is for unemployed Kenyans, so I don't know what happens if you're in employment and you'd like to come work in the UK. I don't know what happens then. So this press release, anyway, they mentioned interested applicants are required to register on a certain website, and the deadline would be 27th August, 5 p.m. Kenyan time. So I managed to go looking into the websites mentioned on there, but I could not get any clear way of registration or very clear information on what to expect. So I think at this point it's still a waiting game. We're still waiting. But in the meantime, the UK is still recruiting nurses from different parts of the world. So if you're interested, you can always start the process. Don't wait for anyone or anything if you're interested in working in the UK for whatever reason that is. And that pretty much summarizes my topic for today. I hope this has been helpful to you, and if you find it helpful, please share it with a friend. And if you've not subscribed, please subscribe. Also follow me on different social media platforms. I'm on Instagram, Facebook as World Class Nurse, on Twitter as Gertrude_Aren, and on LinkedIn both as Gertrude Orodo and as World Class Nurse. Thank you so much for all the support. Feel free to leave a comment, to share, to like, give me your opinion. That's it from me today, guys. Keep staying safe, keep sanitizing, keep social distancing, and bye.